It's a lesion.
And the big green thing in the middle of the bigger blue thing on a map is an island. I was hoping for something a bit more creative.
Shouldn't we be speaking to the patient before we start diagnosing?
Is she a doctor?
No, but
Everybody lies.
Dr. House doesn't like dealing with patients.
isn't treating patients why we became doctors?
No, treating illnesses is why we became doctors. Treating patients is what makes most doctors miserable.
So you're trying to eliminate the humanity from the practice of medicine?
If we don't talk to them, they can't lie to us. And we can't lie to them. Humanity is overrated. I don't think it's a tumor.
First year medical school, if you hear hoofbeats, you think horses, not zebras.
Are you in first year medical school? No. First of all, there's nothing on the CAT scan. Second of all, if this is a horse, then her kindly family doctor in Trenton makes the obvious diagnosis and it never gets near this office. Differential diagnosis, people. If it's not a tumor, what are the suspects? Why couldn't she talk?
Aneurysm, stroke, or some other ischemic syndrome?
Get her a contrast MRI.
Creutzfeldt-Jakob disease?
Mad cow.
Mad zebra.
Wernicke's encephalopathy.
No. Blood thymine level was normal.
Lab in Trenton could have screwed up the blood test. I assume it's a corollary of people lie that people screw up.
Redraw the blood tests. And get her scheduled for that contrast MRI ASAP. Let's find out what kind of zebra we're treating here.
Radiology, please call the page. Radiology, please call the page. Respiratory therapy to the art staff.
I was expecting you in my office 20 minutes ago.
Really? Well, that's odd, because I had no intention of being in your office 20 minutes ago.
You think we have nothing to talk about?
No, just can't think of anything I'd be interested in.
I sign your paychecks.
I have tenure.
Anesthesiologist.
Are you gonna grab my cane now? Stop me from leaving?
That would be juvenile. I can still fire you if you're not doing your job.
I'm here from 9 to 5.
Your billings are practically non-existent.
Rough year.
You ignore requests for consults.
I call back.
You're
Sometimes I miss
6
dial.
years behind on your obligations
See,
to this clinic.
I was right. This doesn't interest me.
6 years times 3 weeks. You owe me better than 4 months.
It's 5 o'clock. I'm going home.
To what?
Nice.
Look, Dr. House, the only reason why I don't fire you is because your reputation is still worth something to this hospital.
Excellent. We have a point of agreement. You're not gonna fire me.
Your reputation won't last if you don't do your job. The clinic is part of your job. I want you to do your job.
But as the philosopher Jagger once said, you can't always get what you want.
You're not my doctor, are you, Dr. House?
Thankfully, no, I'm Dr. Chase.
Dr. House is the head of diagnostic medicine. He's very busy, but he has taken a keen interest in your case.
We inject gadolinium into a vein. It distributes itself throughout your brain and acts as a contrast material for the magnetic resonance imagery.
Basically, whatever's in your head lights up like a Christmas tree.
It might make you feel a little lightheaded.
Dr. Cameron, I'm sorry I have to stop you. There's a problem.
You pulled my authorization.
Yes, why are you yelling?
No MRIs, no imaging studies, no labs.
You also can't make long-distance phone calls.
If you're gonna fire me, have the guts to face me.
Or photocopies. You're still yelling.
I'm angry! You're risking a patient's life.
I assume those are 2 separate points.
You showed me disrespect. You embarrassed me. And as long as I work here, you have
Is
no
the yelling
legal...
designed to scare me? Because I'm not sure what it is I'm supposed to be scared of. More yelling? That's not scary. That you're gonna hurt me, that's scary, but I'm pretty sure I can outrun you. Oh, I looked into that philosopher you